out for you. This is Newswatch 12 Breaking News.
Presumed cases of the virus in Oregon. 3 of them are in Southern Oregon. We've been bringing you updates all morning long on air and online. Let's go live right now to the Jackson County Health Office, where they're holding a news conference with the very latest on the 2 new cases in Jackson County.
The latest information that we can with you so you know how to best protect yourself and your family. So I want to start by reminding you that the rights of community members to confidentiality is really paramount, and so we're going to share information that we can, but we will not share any identifiable information about these presumptive or confirmed cases of COVID-19. We have 2 presumptive cases of COVID-19 in the county. These are both adults. They're aged 55 to 74. These are travel related, and they are in one household together. The individuals have been fully cooperative with Jackson County, and we don't feel there's any identifiable risk to the greater community in Jackson County, and there are no known community spread at this time. Just to be clear, when we say presumptive case, what that means is the test that we ran at the Oregon State Lab was positive. The test will then be confirmed at the CDC lab, and then it will be a confirmed case. Okay. So we've worked diligently to identify and notify all known contacts of the presumptive cases through our usual case identification process. That includes identifying all known contacts of the presumptive case, notifying them, do risk assessments, and this allows us to apply monitoring requirements that have been established by the CDC and the Oregon Health Authority. So we have identified all those contacts, and we have had some individuals under monitoring where we get their temperatures and we communicate with them on a daily basis, just to be absolutely safe. All persons under monitoring are monitored by Jackson County Public Health for 14 days, although that's a bit variable. As testing becomes widely available, we do identify the possible identification of other cases. So, we've activated our County Emergency Operations Center, and we have dedicated staff who will fill the various positions and respond as appropriate. Can we stop for a second?
Yes.
I'm pretty sure that means that there's somebody else out at the lobby.
Yeah.
Let me go get. Sorry. Go take a quick break.
Well, as you saw, that is Dr. Jim Shames from the Jackson County Health Department describing what they are doing so far after finding 2 presumptive cases of coronavirus in Jackson County. Just to review, if you are joining us, these 2 cases are from people who are traveling out of the area. As of right now, they are in their own environments, they are in their homes, they are self-isolating. The county says there have been no cases of any kind of community spread at this point. They say they do have people under monitoring, but as of right now, they do not have any other cases other than these 2 cases they trace back to a traveling situation. Those individuals are ages 55 to 74. Now, because of privacy concerns, that's all the information they are providing for us about the people involved. They did mention moments ago they have set up an emergency team that they are going to staff with members of the County Health Authority, that they will be monitoring those folks. They'll be reaching out to them. Those individuals, as I understand it, will then be taking their temperature. They'll be working with members from the county to make sure their situation and status does not change. Now, we also have information about the cases that are also unfolding in Klamath County today. That individual, as we understand, is in the hospital. The two cases that we are discussing right now in Jackson County are in their homes. They are self-isolating. Dr. Jim Shames started that news conference today talking about a team that he has set up within the county to make sure they have constant outreach with those individuals. They also said that the county has reached out to individuals that those two cases may have contacted in the community. As of right now, they have not found any of those contacts to be positive. Now, he also said that the two people in our area have taken those tests that are administered by Jackson County in the state of Oregon. Those tests were then taken to the Oregon State Lab, where they were confirmed to be positive. Now, they will not be officially positive coronavirus cases until those findings are sent to the CDC lab to be verified. There is one confirmed case in Oregon right now that has gone through that process, two other presumed cases as of, let's go back now to Dr. Jim Shames, see if they have updated this particular meeting.
Give it to you.
Yeah.
Any thoughts about just going through the meeting or
Well,
just
some of
take
the
it?
Facebook Live, so we'll be.
Mark's looking for someone else.
What's that?
Mark just went to look for someone else.
Okay, all right.
A couple people just walked out, we're letting them set up before we continue.
So as you can see, this is unfolding live. I thought Dr. Shames had resumed the news conference, bringing up to date once again. We have two confirmed cases, presumptive positives in Jackson County. Those individuals are self-isolating. They're staying in their home. They're being monitored by the county. We also know that those who have been contacted by those two people in the county are now on 14-day monitoring by the county themselves. They have set up a specific team that will be outreaching to those people to monitor their health situation. As of right now, there have been no cases of community spread. Those are situations where the county and or other health authorities have not been able to find the source. In the cases of Jackson County, they know specifically these are travel-related cases. These two individuals are not yet in the hospital. Their health is not at the point where they need to be constantly supervised by a medical professional. They have been, as we are told, very cooperative so far with the county in giving them information about who they contacted, where they might have been exposed. In all of these cases, not only in our area but others, there are strict confidentiality laws that county, state, and federal authorities have to abide by.
So
let's go back now to Dr. Jim Shames.
we know that there's concern in the community about the novel coronavirus, and we here at Jackson County Public Health understand that concern, and we're going to do our best to share information that the community can use to protect themselves and their family. Public health values the rights of our community members and the confidentiality regarding their medical information, so we're not going to release any identifiable information that could possibly identify a presumptive or confirmed case of coronavirus. We have two presumptive COVID-19 cases. They're both adults between the ages of 55 and 74. This is travel related, and these individuals are in one household. Neither individual required hospitalization, and they remain isolated at home, and they've been fully cooperative with Jackson County Public Health. There's no identifiable risk to the greater community, and there's no known community spread at this time. Just to be clear, when we say presumptive case, we mean a case that is tested positive at the Oregon State Laboratory and needs to be confirmed at the CDC laboratory, and then it will be called a confirmed case. So we're working diligently to identify, we have worked diligently to identify and notify all known contacts of the presumptive cases, and this is what we do at Public Health. This is contact case investigation, and we've identified all known contacts. Those that needed to be isolated have been isolated, and we are following the recommendations of the Oregon Health Authority and the CDC. Jackson County Public Health has identified all the known contacts, and there's no one else that we're aware of that needs to be identified to. The people under monitoring can be monitored generally for 14 days, which we believe is the full incubation period for this disease. And we have individuals in the Southern Oregon area that are under monitoring, as is true throughout the state and the nation. As testing becomes more widely available, we do anticipate that there will be additional cases identified. We've activated our Community Emergency Operations Center. We've dedicated staff and resources to this response, and we will continue to work closely with the Oregon Health Authority and the CDC and our community partners on this response. So here's where the situation stands now. This is a new disease. It's caused by a novel coronavirus that has never existed in humans before. We have other coronaviruses that cause the common cold. This one is different. It's novel. It generally causes mild illness. We need to remember that 80% of the people that get coronavirus have mild illness, and that we are probably identifying mostly the people that are more significantly ill, so the numbers may change. We expect them to change over time. The symptoms are fever, cough, evidence of a lower respiratory infection, weakness and shortness of breath, chest pain as the disease can get more severe. The elderly are at significantly more risk than younger individuals. Children don't seem to get the disease very much, and when they do, it's pretty mild. Some of the data we have comes from China, and what we know is that as the disease is spread around the world, some of the statistics look quite a bit different. So although the mortality rate and the hospitalization rate was fairly high in China, it is beginning to look that the data is a little more favorable as we start looking at what's happening in the United States. You need to remember this is a disease that is spread from person to person by droplets, so that when somebody coughs or sneezes, the droplets can go out 3 to 6 feet from them and possibly infect another person. It's transmitted either by getting those droplets on your mucous membranes directly or from inanimate objects. And so a reminder of the things that we're asking the public to do. One is to, if you're in a high-risk category, over the age of 60, have a pre-existing chronic disease like cardiovascular disease or lung disease, you may want to think about putting yourself in jeopardy by being in crowded places and doing some restriction of activities to keep yourself safe. We recommend that if you have a coughing illness and you're going to be around other people, that you wear some kind of protection, a mask or something to keep those droplets from affecting others. We do not recommend mask wearing for the general public. There's no evidence that it's really beneficial. We need to wash our hands frequently. We need to do it thoroughly. We need to teach our children how to do it. If you don't have soap and water, then hand sanitizer should be made available. There's a number of really excellent videos that remind us all how to wash our hands. We need to stop touching our faces and touching our eyes and our nose and our mouth. And, it's kind of a nervous habit I think we can learn to break. And I guess the only other significant point I want to make is that we need to start thinking about ways to reduce social contact. It's called social distancing, and there may be work situations where you could be working from home. There may be gatherings that you might want to postpone. These are things that would be good to institute now. We do not have any evidence of widespread coronavirus in our community, but the way to reduce the activity from preventing it from being a widespread situation here is to start instituting those behaviors. The other important issue is what to do if you are feeling ill. If you are, if you have a cough and you have a fever and you're not terribly sick, you could remain at home and drink plenty of fluids, do whatever you need to do to control your fever, try and avoid contact with other people. If you think you need to be seen because you're getting seriously ill, you should call your healthcare provider ahead of time so that they can see you in a way that reduces the spread to other people. So healthcare facilities are prepared to handle that situation. It's helpful for them to know that you need to be seen so they can put you in a special room, put a mask on you when you arrive, that sort of thing. Okay, any questions?
I have one. Newswatch 12's Leah Thompson. Earlier on the conversation with Oregon Health Authority, you said there was no risk to spread within the community. Can you explain how you're sure of that?
We're not sure of that. We can do our best to assess the potential risk. You know, some people don't know that they're spreading the disease, and they have lots of contact with other people. That was not the case here.
Okay.
What I think is evidence that there is community spread in this country at this time. So there may be individuals who have the novel coronavirus that we aren't aware of. But our assessment of this situation is that these individuals were very cooperative. They had their own concerns and they kept to themselves. And I think that the risk of spread is not severe.
Are there any virus tests for people?
The coronavirus test is we can obtain the specimen here and we can send it to the state. So we have nothing more local than that. I would like to mention at this point that when we talk about testing, we're talking about a swab that goes into the nose to the back of the throat, can often make people cough. It's not terribly comfortable. So the test is it's not simple to perform, and the people performing it need to be wearing full protective gear. So it's not a test that can casually be done and needs to be done properly by appropriately trained healthcare providers.
Is there a screening process for deciding who gets tested?
Yes, absolutely.
Who gets tested?
So that criteria changes on almost a daily basis as more tests become available and as we learn more about the disease. So we are testing individuals who have reason to have had contact. Perhaps they were traveling internationally, or they had contact with somebody who was known to have COVID-19 and has symptomatology. And then those folks can be tested. And previously the testing had to go through public health, and at this point, when people fulfill certain criteria, their healthcare provider can ask for the test and the test can be authorized.
About the two cases in Jackson County, they're 55 to 74 years old. Can you say how they're related? Are they roommates, brother, sister, married? Anything of that nature we can know about them?
So the smaller the community, the more likely it is that we could inadvertently provide information that could identify them, and that would be breaking our trust. So we really can't provide any more information than that.
Another question I have, I know it's a new type of virus. If you get it once, could you get it again?
We need to remember we're really just a couple of months into this outbreak, and we're learning as we go. We don't believe so, but we may find out otherwise in the future.
The tail end of the cold and flu season right now in March. If somebody feels, it seems like I've heard that COVID-19 is relatively mild symptoms for a lot of people. If somebody's feeling sniffly, should they be alarmed? How should people proceed?
Well, this is perhaps a good reminder of what we ought to be doing all the time with viral infections. You know, we are a little casual about putting other people at risk. If you're sick and you have infected material that's coming from your body, you should isolate yourself. Don't go to work, don't go to school, don't put up other people at risk. And what might be a mild illness for you could be a really serious illness for someone else. So I think that's being a good citizen, and this is a reminder of that. This does resemble the flu for many people. It may even resemble like a cold for children. But those at risk, you know, the elderly, people with cardiovascular disease and pulmonary disease, can get very seriously ill. It looks like the mortality rate for those 80 and older, for example, is much, much higher than it would be for younger individuals.
These cases were travel related. Can you tell us where they went to or where they came from?
No, I'm sorry, I can't.
Can you tell us if they were traveling within the U.S. or within internationally?
By travel, I mean international travel. We're talking about people who were out of the country.
Continent.
Continent. Yeah, sorry.
So with regards to screening people, are we only concerned about people who have gone to China, or are other countries that are experiencing an outbreak?
Well, there are a number of countries that have significant outbreaks. China and South Korea and Japan and northern Italy, and you know, tomorrow there'll be more countries on that list. So the criteria change as the situation on the ground changes.
So is their condition improving at this point?
Yeah, they're doing well.
They're getting better.
Yeah. Yeah.
So I have more like a general question. You could say, how long do you know the virus lasts on the surface for?
Right. This appears to be not a particularly hardy virus, so that it doesn't take much to kill it. It might remain on inanimate surfaces for hours, potentially for days, and it really depends on the surface and the conditions. The good news is that we believe you can easily kill this virus in any one of a number of ways. So you could use soap and water, you could use an alcohol-based disinfectant, a dilute bleach solution, and you can effectively disinfect surfaces.
My last question is about treatment. Can you walk through what treatment looks like if you are diagnosed with COVID-19?
Sure. So people talk about the comparison of this disease with influenza, which is valid to a point. Influenza, we have a vaccine, which is pretty effective, and we have antiviral medications, which can be effective if used early. We do not have those tools available to us for this disease. So what that means is the treatment is symptomatic. For people to get very ill who cannot get enough oxygen because of their lung disease, that symptomatic treatment may be providing them with high-dose oxygen, actually putting in a tube and breathing for them, giving them IV fluids, etc. So that's the level of treatment. It definitely does, it allows people to weather the storm. You can provide that level of intensive care and they can come out the other end. And that's one of the reasons that, depending on the sophistication of the healthcare system or whether the healthcare system is overwhelmed or not, can greatly influence mortality rate. If you have access to that level of care, you can save more lives.
Does this come to the attention of the health department here? Did my hospital call you, or how did you come across these cases?
I really don't think it's appropriate to identify that, because we really don't want to identify the individuals.
Yeah, I understand.
Okay.
Do you think that the U.S. could have done something differently to prevent the outbreaks that we're experiencing now?
So the basic tenet of handling an outbreak like this is to be prepared, and I think we've had a number of of preparatory occurrences, such as preparing for H1N1, preparing for the Ebola, thank you, preparing for Ebola, et cetera. And so the nation as a whole and our preparedness system in specifically have gone through this exercise. We work with our community partners, et cetera. Nevertheless, something comes along that is novel. You have to learn new lessons. I don't know the details of what happened with the testing issues with the CDC. That definitely has set us back. We would like to be in a position where we could test more people, understand the spread, get a better sense of how this disease is presenting. You work with what you got.
Do you think limited resources in rural areas will put us at a disadvantage?
I think it's always pluses and minuses to being rural. Probably fewer opportunities for congestion that can promote spread. I think there's an advantage for all the key partners to know each other by name and to be able to sit down and get things done. And yet we probably, have fewer staff and fewer resources. So I'm not sure about that. I can see it either way.
Any other questions? Okay.
Well, it sounds like you're pretty confident that we're not going to get an outbreak in Jackson County. Is that right?
That is not right.
No? Okay.
I think, here's our strategy. In the case of spread throughout the community, which we don't seem to have in Jackson County, but we certainly could, what we want to do is to minimize the spread to individuals who are at risk of getting seriously ill. And by doing that, we don't overwhelm the systems that we have in place. If we can keep the disease at any one point from getting very, very high, that means we have intensive care unit beds, we have hospital staff, we have EMTs, everybody available to help us get through this. And that's one of the primary roles of all of us standing up here. But we can't prevent something that's inevitably going to happen. We can prepare for it, we can mitigate it, and that's what we're doing.
So is there any chance this might spread on over to Josephine County?
I'd say the risks to you are pretty much the same as the risks to us. We're all in this together.
Yep.
Okay.
Any other questions? Okay, thank you.
Thank you.
Mike's right.
Fitting words from Dr. Jim Shames and the Jackson County Health Authority. We are all in this together. To recap what we heard today, 2 cases of coronavirus, presumptive cases, have been found in Jackson County. Those individuals have been in contact with the county health department. They are self-isolating. They are not in the hospital. They do not need hospital care at this time. The Jackson County Health Authority believes at this point that they have talked to the majority of the people that those individuals have had contact with. Those individuals are being monitored. Those are going to be monitored for the next 14 days. That is what the key time period is to find out if, in fact, those people have become sick. Dr. Shames did not say that at this point that this is in any way contained. He did say right now that they are focusing on trying to keep the virus from spreading, making sure only those at the highest risk groups are getting tested right now as a way to keep our medical system from being overwhelmed. He did indicate that those tests should be provided by skilled and trained healthcare professionals. Right now, tests can be taken in our area. They are then shipped to the state of Oregon's laboratory, at which point those results are then relayed back. And then the Centers for Disease Control and Prevention will or will not make that case an official coronavirus case. Again, he said right now there is no indication that there is any community spread, but he did not rule out the possibility there won't be more cases. He's also indicating that as more people get tested, their number of cases may increase, but as of right now, 80% of the individuals that they are seeing present with mild symptoms. The other 20% are the folks they are focusing on and why they're working so hard to make sure the virus does not spread out of its current containment level. That being said, he does indicate that we probably will see more cases not only in Jackson County, but in Josephine County, and we already know there may be another case in Klamath County. There's a news conference on that issue scheduled for about 2:30 this afternoon. We'll learn more about that individual who we understand is being cared for in the hospital. You see the information next to me right now outline the two presumptive cases, 55 to 70 years old, travel-related exposure. They know at this case where those people may have been exposed to the virus. They are isolating themselves at home. Again, 80% of the people with the virus so far are presenting with mild symptoms. It's that 20% they're most concerned about. The older an individual is, the higher the risk to those individuals. Right now, there does not seem to be a high risk for children. Dr. Shames also said right now, there is just not a lot of information about this novel virus. It's never presented before, so at this point, they're sort of learning as they go. And again, we go back to what Dr. Shames said. We are all in this together, so we have a shared responsibility to protect ourselves, our family members, and others by taking the precautions that we have all been outlined, and not only on this newscast, on the website, and from the federal government. Wash your hands. If you think you are sick, use some kind of protective mask. But if you are not sick, the mask, as of right now, we are told from health professionals, will not help prevent you from getting sick. That should do it for this update. As I said, there is another update from Klamath County later this afternoon. We'll bring that to you live as well. For now, I'm Brian Morton from Newswatch 12. We return you now to regular programming.